Hello, welcome back to Voice of Mzansi, where we bring you the stories that matter to the people and shake the streets of Mzansi. If you're new here, hit that subscribe button and stick with us till the end so you can hear the sources of this news and go verify it for yourself. Now let's get into this intense one. A Durban hospital turned into a battleground this week after a group of people reportedly blocked undocumented migrants from accessing medical services. Yes, inside a hospital. What's meant to be a place of healing quickly became a place of chaos, shouting, and tension. It happened at Addington Hospital, right along Durban's beachfront. According to multiple eyewitnesses and health workers, a small crowd gathered outside the hospital's outpatient entrance during the early morning hours. The group, mostly South African citizens, was reportedly protesting what they say is the continued strain undocumented foreign nationals are putting on the already struggling public health system. Things escalated quickly when some of them began confronting patients they believed were undocumented migrants, accusing them of taking services meant for South Africans. Health workers and security personnel tried to de-escalate the situation, but by that time, the shouting had already drawn a lot of attention. Some patients turned away before even entering the building. Others stood there frozen in fear, not sure what to do. One young nurse who witnessed the scene said, "It was heartbreaking. Some of the people being shouted at were women with children. They were just here to get help, and now they're scared to come back." She added that this wasn't the first time tensions like this had flared up, but it was definitely one of the most public and aggressive confrontations she'd seen. Health officials have since condemned the incident, saying no one has the right to block another person from receiving medical care, regardless of their nationality or legal status. They reminded the public that emergency services in South Africa are available to all who need them. Denying someone health care, they say, is not just unethical, it's dangerous. However, the group involved in the confrontation says their message was not about hatred, but frustration. One of the protesters claimed, "We're not against people, but our hospitals are falling apart. Our people wait in long queues, and some of these foreigners get faster attention because they know how to work the system." That comment has triggered a fierce online debate. Some people are backing the group, saying South Africans should come first in state hospitals. Others argue that hospitals should never be turned into political platforms, and that using vulnerable people as scapegoats for a failing system is unfair and uncalled for. Doctors working at the hospital say this kind of division only makes their jobs harder. They say the system is indeed under pressure, but that's no excuse to start pointing fingers at the most desperate. "We're doing our best with limited resources. Attacking patients doesn't fix that, it just adds fear and tension," said one doctor, who asked not to be named. Security has since been increased around the hospital, and local government officials have called for calm. An investigation is underway to determine if any laws were broken, especially since there were minors and elderly people caught in the middle of the confrontation. This incident is just one example of a much bigger issue bubbling under the surface in South Africa: growing frustration over immigration, public services, and who gets what in a country still healing from deep inequality. But while people are allowed to express their concerns, the question remains, where do we draw the line? Many community members are now calling for dialogues, not protests, real conversations between citizens, migrants, and government representatives to address these tensions before they spill over again. Because let's be honest, hospitals are already full of pain, we don't need to add more. All the images used in this video are for illustration purposes only and not linked to the real people involved unless clearly stated. This article is based on verified reports from Durban healthcare workers, eyewitness accounts, and official updates from KwaZulu-Natal's Provincial Health Department. Feel free to check those platforms to verify everything we've shared. Thanks for watching Voice of Mzansi. Don't forget to like, share, and subscribe. And listen, next time you're at the clinic and that queue starts moving suspiciously fast, don't fight, just thank the admin staff. Nay. See you in the next one.